For many people, dying is something they've never really seen up close. So when someone you care about is approaching end of life, it's natural to feel uncertain, even scared about what to expect. But dying, like birth, is a process. And when we understand what's happening, we can respond with more calm, more care, and less fear. Before we begin, we post death and dying related videos every Friday. So if that sounds like your kind of thing, consider subscribing to the channel. Now let's talk the stages of dying. Before we begin, some notes. Firstly, it should be obvious, but these stages of dying are for the terminally ill or aged. They are not meant for if you get into a motorcycle crash or some other unnatural way of meeting your demise. Secondly, these are the stages of dying, not the stages of demise in your particular illness. What condition or illness you have, cancer, heart failure, dementia, whatever, may impact on particular traits of the dying process more than others. And thirdly, if you're someone who needs organization, a set plan with specific dates and times, this isn't going to go well for you. The human being is biological, not mechanical, so how long each of these stages takes is rarely accurately predictable. With that said, there are three main stages, so let's take a look. Early stage. This stage lasts anywhere between a couple of months and a couple of days and is signaled by a noticeable drop in the interest of food. For many patients, eating becomes more of a burden than a joy at this point. They may also occasionally choke on their fluids and will start to feel full rather quickly. So why is this happening? The body is starting to conserve energy and does not need as much nourishment as it did in the past. Now you may be thinking, they must be starving, they haven't eaten since yesterday. But it's actually not causing them any pain or suffering, nor hunger pains that a functioning body would. This is a natural process where the body shuts down hunger. This is why artificial feeding at this time doesn't prevent death, it will extend their suffering, and forcing them to eat or drink can even lead to physical distress, especially if they're unable to swallow. To provide comfort, by all means offer bits of food, sips of fluid or ice chips, but if the patient doesn't want it, you need to respect that. And under no circumstances force feed them. Middle stage of dying. This is the stage where we most commonly see loved ones panic because it's the stage where the physical changes become very apparent. This stage typically lasts anywhere between a few hours and a few days, but it's typically a lot shorter than the first stage. The patient will be less responsive to their surroundings and those around them, and they will eventually be unable to move or speak. Again, this is okay. If you want to think of it like a system, the body is shutting down and turning the lights out in each department as it goes. As the body's circulation slows down, blood is reserved for helping major internal organs function. Because of this, the patient's hands and feet might feel cold and their appearance could become darker. They could become paler, greyer, and their skin could become mottled or blotchy. Again, completely normal. And no, they don't have gangrene in their feet. To provide comfort for your loved one, you can provide blankets. However, while it may be tempting, do not put heating pads or electric blankets in or on their bed or on them. At this stage, the patient will be unable to judge if they're becoming too hot, which can lead to burns, and we certainly don't want that. Along with the temperature change is the detachment from their surroundings and the relationship with their body. This can include hallucinations and consequently is part of the reason that many people like to believe their loved one is seeing angels or other deceased loved ones at this time. During this time, you should assume that the patient can hear everything you say. Experts suggest speaking softly to the patient and touching them only if they normally like to be touched. If they don't normally like to be touched, you can cause them a huge amount of distress and they can't tell you to bugger off. Additionally, it is not recommended to ask the patient questions that require answers at this time. That ship has sailed. Last stage of dying. During the final stage of dying, which usually lasts under 24 hours, dissociation and restlessness will grow and there will be significant changes in the patient's breathing and continence. This can be confusing, but they often appear asleep but restless. Their senses are failing. The patient's bowel movements may stop entirely or they may become incontinent. Their breathing may become shallow or irregular with long pauses that grow frequent as death approaches. There may also be sounds of chest congestion or throat rattling in their last hours. The restlessness noticed at this stage is attributed to changes in metabolism, while the kidney and bowel functions are affected by decreasing circulation. Relaxing muscles can lead to incontinence. The slowing of blood circulation to internal organs causes the lungs to lose their power to clear out fluid, as well as the relaxation of throat muscles. Some patients may need medication for restlessness, diapers, catheter, or underbody pads. At this point, administering oxygen won't help. However, it may be useful to elevate the head of the patient's bed or use a pillow to lift up their head. Turning the patient to their side may also increase comfort. As a side note here, some patients in their final 24 hours may have a burst of energy to the point where they may sit up and talk normally for a short period. Now, this doesn't change the outcome, but it can be good to be forewarned that something may happen because it can catch a lot of people off guard. Signs the end is near is glassy, teary eyes that may be half open, cold hands, weak pulse, hallucinations, being fast asleep, gasping, or periods where breathing completely stops. The actual moment of death is usually peaceful. Hi all! If you're getting something out of this video, please show us some love and click the like and subscribe buttons. And if you really like it, perhaps consider sharing it with others. Remember, we provide online educational consults on any death topic that you may require help with, so visit our website to book. The link will be in the description. And now, back to the video. Things to keep in mind. Very often, a dying patient is restless or disorientated. That may range from slightly agitated all the way through to attacking people. Oxygen is not getting to the brain, organs are shutting down, so not all departments are online to deal with the senses that are bothering them. And when providing comfort care, you need to keep this in mind. You are not dealing with a rational, functional human. Think of this situation through the eyes of parents with a newborn. And by that, I don't mean see the dying person as a baby. No. I mean, when you come home with a newborn, they have no other way to tell you that something's wrong with them other than to cry, and it is your job to work it out. Their foot is too hot, the sheets are itchy, a strand of hair is wrapped around their little toe, something smells bad, the lights are hurting their eyes, they hurt, they want a hug, they need fresh air. You get the idea. You need to work this out and monitor it before you insist on giving them more meds. Meds are great. We love meds, don't get me wrong. But if you don't work out what's bothering them and it's something that can be easily fixed, it will still agitate them with meds. Their brain will still be telling them that something's off, but they will just look more peaceful to you. Next up is breathing. Firstly, the stop-start breathing pattern, again, a lot like newborns. A dying person will have very shallow breathing, and they will often seemingly stop breathing for 10, 20, 30 seconds at a time before they start again. This is completely normal, very, very common, and it's not hurting them at all. The other breathing things to be aware of is that it can be noisy. As coughing or swallowing reflexes slow down, saliva and mucus may collect at the back of the person's throat, causing gargling, bubbling, and other noises. The noise often causes more distress to the loved ones than it does to the patient. To help improve the situation, you can lift the person's head and support their head with a pillow or turn their head to one side. However, if the patient shows any resistance to being moved in that position, leave them where they are. And for the love of God, don't put your fingers down their throat because you think there's something caught down there. Just don't. I'm surprised that we've actually seen that. Medications can also be given to slow down the production of saliva and mucus and thus improve comfort. Thirdly, and this tends to be more off-putting to those relatives who are late to the party, but someone in their dying days is not going to be looking that flash. Their skin will be blotchy and thin. Sometimes it will have a yellow or purplish tinge. Their eyes look sunken, cheeks hollow. They often contort their limbs. Their mouth is often slacked open and they look dehydrated because they are. This is all completely normal. This is what dying looks like. It doesn't look like the movies where they put on a bit of pale makeup on the body of a perfectly healthy actor. Next up, changes happening to the person's body means that they may spend a lot of time asleep, may be drowsy or difficult to wake up. So if you want to talk to them, do it when they are at their most alert and let them sleep otherwise. Don't be shaking them awake, calling out loudly to them, flicking the lights on and off. You're not trying to wake up a 14-year-old kid to go to school in the morning. Let them sleep, and when they're awake, it's best to speak softly and naturally. No baby talk either, that is disrespectful. Lastly, let's talk about comfort meds. These are the medicines commonly used in palliative care to provide a level of comfort rather than treatment to a patient. They are most commonly used to help with pain, nausea, constipation, vomiting, and drying respiratory secretions. So do you need to have them? No, of course not. Much like the birthing process, you could choose to go all natural and feel it all, or you could choose from a variety of pain meds to take the edge off. Either's good. Also, palliative care includes many more things than just meds, so don't turn it down just because you don't want comfort medication. Check out our video on that. All this means that a patient can go through these 3 stages within a couple days or a couple months. Asking a doctor to predict how long someone has once these stages start is a bit like asking how long's a piece of string. There's really no way of knowing. Someone going around an office block and turning all the lights off before they leave for the night could be very quick, or they could get sidetracked. But the point is, watching someone in the stages of dying isn't pretty, but it is natural. Comfort yourself by knowing that. And with that, go talk death.